Because life is so much better when a child smiles. Welcome to Child Smiles TV. At Child Smiles TV, we're all about discovery. There are so many ways to improve the joy, health, and fulfillment families and children experience in our towns, and we're on a hunt to find some of the most talented, creative, and experienced Child Smile experts and get their thoughts right here on our show each month.
Hi, I'm Dr. Andrew Cheifetz, and I'm today's host of Child Smiles TV. As a pediatric dentist and a Child Smiles specialist, I spend my day working with kids and making sure they have great smiles and really enjoy what they're doing. So today, I have Dr. Gregory Kaupp. He is dual certified in both pediatrics and internal medicine. In addition to that, he has 4 amazing kids, and he is a crazy good mountain biker. So Dr. Kaupp, thanks so much for joining me today.
Yeah, thank you. Thanks for that wonderful introduction.
No problem. I try and do my best. So I know you wanted to come here and talk about childhood obesity, and one of my first questions is, how serious is the problem of childhood obesity?
Well, childhood obesity is a very serious problem. I'm sure you've heard plenty of it in the mainstream media. The statistic is that about 1 out of 3 children is overweight or obese, and that number increases to about 60% by the time kids reach adulthood. So look around. Just go someplace in public and take a look at the kids. You'll see that a lot of them are overweight or obese. It's right under our noses.
It is true, because you walk around anywhere and you see, I've seen kids being wheeled in strollers and seeing them how far overweight they are, and I think to myself, boy, if the parents would just let them walk a little bit.
Absolutely.
So, what are some of the health consequences of a child being obese?
Well, there's social and emotional consequences that I think are an immediate impact. So those kids are at increased risk for depression and low self-esteem, and they may be bullied at school and whatnot. And then there are medical consequences. So the medical consequences are things that people think of as adult diseases, but we actually do see them in children, unfortunately. So we see children who have type 2 diabetes or pre-diabetes. We see children who have hypertension, high blood pressure, high cholesterol. We see children who get their gallbladders removed at young ages because of fat-related conditions, fatty liver disease, sleep apnea.
Wow, that's something I never would have known. Like you said, these are all things you hear about in adults when they're obese, but I think it's really important for parents to know that these can happen with their kids if they're obese. One of the things in my practice that we see all the time, and I'd be curious to get your point on it, is we have kids who turn a certain age and they start drinking a lot of soda and sports drinks and juice, and we find kids that may have never had a cavity up until the age of 12 or 13 all of a sudden have 10 to 15 cavities. So do you think that's something that also affects obesity at all?
Absolutely. So I think when I talk to parents about what they can do about childhood obesity, one of the highest yield interventions that can be done is to eliminate soda, sugar-sweetened juices, even juices that say not from concentrate or 100% juice are actually mostly sugar. They're empty calories. So you're seeing the cavity consequences, the oral health consequences. I'm seeing the weight-related consequences of those. But if we can get kids to drink water instead of sugar-sweetened beverages, that intervention alone will help reduce their body mass index, make them a healthier weight.
I think that's a great point. And, one of the things that, as healthcare providers we're up against, it's the marketing. And these companies have unbelievable marketing that the kids think, if I'm going to drink this, I'm going to be as good as that athlete that I see on TV. So that's a hard thing to overcome, but I think it's great that you speak about it when they go to the pediatrician, and again, we harp on it when they come here to see us, and same thing where we tell parents, water's great, enjoy water. For how many thousands of years have we done okay on just water?
Absolutely. When you're thirsty, your body's asking for water. It's not asking for Gatorade or other sports drinks,
Exactly.
And I think it's funny that you mentioned the marketing, because television viewing is a big problem. We have so many kids are playing video games and they're sedentary and they're not exercising. And when they're watching television, they're actually seeing commercials for some of these sugar-sweetened beverages, and then they're making extra trips to the kitchen for those snacks. They're consuming more calories while they're playing their sedentary games or watching television.
And that's also very true, because I find myself, when I take a half an hour TV at night, I find myself going to and from the kitchen, getting snacks, and finally thinking to myself, stop, there's no reason to be eating. And so now what I've started to do with my kids and myself is, after we eat dinner, we'll go right up and brush our teeth, and I'm too lazy to brush my teeth again, so that's it for me for snacking. So it's kind of taken that whole aspect out of it. Listen, Dr. Kaupp, I really appreciate you being here with us today, and I think the information you gave us was great. Thank you so much.
Great, thank you for having me.
My pleasure.
Now for the Children's Dental Center of New Hampshire Child Smile Tip of the Day.
It's exciting to have Dr. Kaupp here as our first guest, and as the Child Smiles TV tip of the day, let's take some action. Let's get those sugary drinks out of the house. It's a pretty easy thing to do. If they're not there in the house, it's not an argument. I tell my parents in my office all day long, don't even buy it. If you don't buy it, they can't argue about it. If they want to say, Mommy, I want my juice, I want my soda, fine, go find it. It's not here. And then, what I tell my parents, it's moderation. When you go out to eat, having juice is the most exciting thing for them. So let's try that. Get those sugary drinks out of the house. Thanks so much for watching Child Smiles TV.
Visit the link below to learn more about our expert guest. Also, visit the Children's Dental Center of New Hampshire website. Get a children's dentist, because general isn't good enough for your child's smile. Remember, moms and dads, every infant should schedule their first and very brief visit to Children's Dental Center of New Hampshire by 1 year old. It's easy, and you'll see how important it is when we meet. Because life is so much better when a child smiles.